Hey, good morning, everybody. It's 8:30 already here on the old morning show, and it's time to go back to the hospital. It seems like they just keep coming in. I swear. Every time you turn around, the hospital's back in there. Don't you open up a emergency room here and something? That'd be nice.
Well.
Oh, let's not.
Or a clinic. Just a small clinic here would be nice. Okay, well, what do we got going on here today? We're going to find out some information that probably the three of us don't know a lot about, right?
Exactly.
Okay.
Yeah, the three of us, not the three of them.
Well, they know.
Hopefully they know.
Let's hope they know. Anyway, introduce yourselves. Let everybody know who you are. That'll be the best way since we got so many of you in here.
Yeah, hi. I am Leah Passalacqua, and I'm a physical therapist at the Richard E. Workman Complex in Effingham here, and I specialize in pelvic floor, and I have my PRPC, which is the practitioner certification for pelvic floor, and I think that I'm about the only one in this area. The closest one might be St. Louis, Chicago, and Indy.
Go, Leah.
So,
All
yeah.
right.
Yeah.
Making a good name for the Passalacquas. Very good.
There we go.
Yeah, I'm Jessica Mottashed, and I have my doctorate of physical therapy, and I work for HSHS St. Anthony's as a outpatient physical therapist. I also specialize in pelvic floor physical therapy. Haven't been doing it as long as Leah, but I have almost all, after March, I will have all the levels of certification for pelvic floor therapy.
She's a doctorate, so she's
Yeah.
tired. So let's hear it
Yes.
for her.
Yeah.
She's up all the time. And you're here again.
I am here again. I'm Tammy Preps, and I am the Director of Rehab and Wellness at the Workman Complex.
Way go, Tammy. All right.
Applause for everybody. We're going
Except for us, because we don't know anything.
Yeah, not a clue. But pelvic floor. Tell us a little bit about it, Leah. You're the main cog here, I think. Well, tell us a little bit about that.
Sure. So what we do is specialize in the lower core and pelvic floor. So it includes a vast range of different diagnoses, everything from incontinence, pelvic pain, pelvic prolapse, which is the descending of internal organs, a lot of post-cancer patients, and also tailbone pain, and a lot of high-level athletes that have different types of impingements and pain as well. So it is a very specialized area of physical therapy, and what we do is we evaluate the patient. We do a full body assessment, and we do that in a private treatment room. So they get a full physical therapy evaluation, and then in addition to that, some specialized pelvic floor assessment. And that process takes about 90 minutes. And so it's one-on-one, and it's very detailed, and everyone is treated very much as an individual because everyone's symptoms vary, everyone's exact concerns vary. What bothers one person might not bother another person. So we look at what their goals are and what they really want to accomplish while they're with us.
Oh, that prolapse. I know some people who've had that problem, and that can be a very painful and a dangerous situation.
Yes. Mm-hmm. So we get a lot of referrals from gynecologists, from urogynecologists, from general practitioners, and of course physician assistants and nurse practitioners for this type of thing. And a lot of times, they do need a surgical intervention, but they like to try something conservative before, so they'll often refer for physical therapy. And statistically showing that even if they do go on to need a surgical intervention, that their outcomes are much better if they do physical therapy prior to get that area more tone and able to support that.
I'm not familiar with this term even. I don't know. You've given us great information. Pelvic floor. Who named it that? Pelvic floor.
Neither one of these two did that. I don't think so.
That's really funny because I started this probably 15 or 16 years ago. Yeah. I've been a physical therapist for about 25, and it was a specialty that was just really not known at that time. But we're starting to kind of really go more mainstream. There's a lot more push to educate people because it's not something that's well known. and it's not something that's well understood. And there's this huge gap and misconception of that people just have to live with this, you know, and they just have to put up with it. But in fact, they don't. There's things that we can really do to help improve people's quality of life and, you know, help reduce that stress and anxiety that a lot of these things cause, because it definitely affects people's feelings about themselves and also their quality of life. I mean, my goodness, if they're going out to eat and the first thing they have to do is look to see where the closest bathroom is, that's no fun. Or if they're, you know, traveling in a car and worried about where they're going to be able to stop, you know, there's all kinds of different things that really do affect one's quality of life.
Jessica, what causes all this? Do you?
Yeah, so for pelvic organ prolapse, there's many different causes. One of the main ones that we see is after childbirth, so, you know, pregnancy and delivery. But even like someone that has chronic cough and respiratory problems, every time they have that chronic cough, they're putting pressure through that pelvic floor, and it's causing those pelvic organs to dissent if there's weakness. Pelvic organ cancers, and then like surgeries. So if a woman had a partial or a total hysterectomy, they don't have the organs that they had before to give support, and so those ligaments just kind of stretch and fall. And then age and genetics play into it as well. So if someone's mother had a history of a pelvic organ prolapse, they'd be more prone to have that as well. And then as we age, our tissues weaken and we can't support our organs as well. So that's why they descend.
Gravity is a bad thing for a lot of things. No doubt.
Yes.
So what do you do to help people with this?
So there's a variety of different things depending on the cause. First thing we look at, because we see people all across the spectrum. So our youngest patient that we probably typically treat for this is around the age of 4 or 5, not for prolapse, but for pelvic floor concerns, all the way up to, I think my oldest patient has been 98.
Wow.
So,
Ooh, I got you beat. I had a 102.
Holy cow.
That's amazing.
yeah. So depending on if it's muscle weakness, we work on teaching them how to contract the correct muscles. It's a very small area, and sometimes people will do what we call muscle dyssynergia. So they'll contract the wrong muscles, which actually make the pelvic floor weaker because they're not contracting the right muscles. Or they have high muscle tone. So it's kind of like they're doing a bicep curl without straightening their arm all the way. They're just doing like 20% of a bicep curl, so they don't actually get stronger. And then we'll teach them stretching and that kind of thing. And that's where we talk about it being very individualized.
Yeah, we also have Biofeedback, and Biofeedback is an awesome computer program that HSHS St. Anthony's has provided for us to use, where we use external patches or electrodes that go on the pelvic floor musculature, and then we can see how much muscle how well they are contracting and relaxing their tissues. So, you know, someone may come in and they may actually need to relax their tissues rather than contract, because if they're constantly in a contracted state, then they fatigue quicker. So that's why the organs then descend. So that's a really great program that we can use for, again, children all the way up to older adults as well.
Very interesting. People out there listening to this are thinking, yes, I have problems. I didn't know even who to turn to. What's the best step for them to get involved in getting some help?
So they can contact their physician or their specialist and get an order and have it faxed to HSHS St. Anthony. And our fax number is 217-347-1558. And we can get them set up with an evaluation at that time.
Man, I'll bet some folks would be hesitant to even talk to somebody about some of the things involved here.
Absolutely, and that's one of the things that we really strive for, is to make everyone feel comfortable. There is no inappropriate or strange question. We've heard just about everything.
I could imagine so.
And, you know, they're real concerns. So we're just as concerned as they are, and we want to see them, you know, succeed.
Gosh, now, no sense having a problem or hurting if you don't have to.
That's right.
Yeah, just make the first step and get it taken care of.
Yeah.
Well, Tammy wants to talk about, she's become a regular member of the morning show. And so tell us, you want to do some updates on what all's happening.
I do. I wanted to give a recap. We've been here several times this month, in the month of January.
She's on the payroll here, as a matter of fact. I saw that.
Just wanted to do a recap real quick of the topics that we've discussed so far. We talked about LSVT, which is a program for patients with Parkinson's disease. It's designed specifically to create sustained improvement in speech and voice function for those with Parkinson's. We also have occupational therapy, a form of therapy for those recuperating from physical or mental illness that encourages rehabilitation through the performance of activities required in daily life. We have a whole pediatric staff. We have pediatric therapists in speech, occupational, and physical therapy who treat children from birth to age 18. We have a certified aquatic therapist. Jennifer was here the other day. She can assist with many types of patients to challenge them in the pool and then transition them to land therapy. Of course, we just heard pelvic floor. The awesome Leah and Jessica just gave us an overview of pelvic floor, and this was their second time. And then we had Sarah. So I've got two therapists that are certified in vestibular therapy, which is an exercise-based program primarily designed to reduce vertigo and dizziness. And then Tuesday we had Alex and John, and we talked about A-stem and dry needling. Those are two different types of tools, I guess you could say, that are in our toolbox to aid in the healing process of when you have therapy. And we have two athletic trainers at the complex, at the Richard Complex. So if you have an athlete that is attending school and let's say they had a sprain or just something that, that they're complaining about, just give us a call and we will do an evaluation for free by the athletic trainers. And then if it has to go on to a therapist or something like that, we'll consult with them.
With everybody getting started with practices because they're finally going to play sports.
Football!
Good time to have something like that available.
That's right. So all you need to do, if you have any questions about any of our services, I know I went through a whole lot there, just give us a call at 347-1243.
Well, the partnership between the hospital and the Workman Complex has really worked out.
It is amazing.
What a nice place, isn't it?
We have specialized parking
we love it.
for handicap. We have a wheelchair assistance program, so we will valet park your car if you need help in. So we have some really good things, and it's just a nice, spacious place. And there's lots of things that you can do, at the complex besides just having therapy.
It's really nice because we're always one-on-one, too.
Mm-hmm.
You're never going to be in a gym with, 5 other patients trying to work out and have to share your attention with the therapist. We're very passionate about what we do, and we're very hands-on, and you'll only be with one person. So
Yes.
I think that's big.
I think we have about 33 therapists.
Oh, my goodness.
Holy cow.
So,
Very nice. And you all get along, right?
Yeah.
yes,
That's crazy.
all the time.
Because here we got 3 or 4 people we can't stand most of the time. Very nice. But no, it's a pleasure to have you guys here, no doubt. We'll talk to you again real soon, okay?
All right, thank you.
Thank you. Appreciate you being our guests. Jessica Mottashed and Leah Passalacqua and Tammy Prolapse.